Hi, everyone, and welcome back to Speak Easy English. I'm Luna. Today's episode comes from a listener in Australia. Nilofer Shariat 2803, thank you so much for your message.
She asked us to talk about the mother and child health nurse visit. If you've just had a baby in Australia or New Zealand, you've probably heard about this. It's a free service where a trained nurse checks on you and your baby after birth.
They usually visit your home, especially in the first few weeks. They check on the baby's growth, feeding, and sleep, and also ask how you're feeling.
If you're a new parent, this visit can feel important, but also a little scary if English isn't your first language. Don't worry. Today, we'll show you how to talk during this visit using real, simple English.
We'll guide you step by step, what the nurse might say, what you can say, and how to ask questions. Let's get started.
Before the nurse visits, many parents feel nervous. What should I say? What if I don't understand?
That's normal. The nurse is there to help you, not to test you. You don't need perfect English. You just need a few clear sentences.
Usually, the visit happens at your home about 1 or 2 weeks after the baby is born. Some visits may happen at a health center too.
You don't have to clean the whole house. Just prepare a few things. Your baby's health record book, if you have one. Any questions or worries. Maybe a nappy or bottle if the nurse wants to see how feeding or changing is going.
And remember, you can ask the nurse to speak slowly or repeat something. They're used to helping people from different backgrounds.
All right. Now let's practice how to welcome the nurse when they arrive. Let's try a real-life scene, your first home visit from the nurse. You open the door, she's standing there. What do you say?
I'll be the nurse this time. You're the parent. Let's go. Hi there. My name's Sarah. I'm your maternal and child health nurse. Thanks for having me today. Is this still a good time?
Yes, of course. Please come in.
Thanks. How are you and the baby doing today?
We're okay. Just a bit tired, to be honest.
That's completely normal. Can I wash my hands before we start?
Yes, there's a sink right over there.
Great. Can we sit in the living room?
Sure. Would you like some water?
I'm fine, thank you. So, how has feeding been going?
Mostly breastfeeding, but we sometimes give a bottle at night.
Thanks. And how's the baby sleeping?
He sleeps in short blocks, 2 or 3 hours. Let's look at what happened in that visit. When the nurse says she is your maternal and child health nurse, she's using the full title common in Australia. It means a nurse who supports families after a baby is born. In conversation, people often just say, the nurse came to check on the baby.
And when you say something like, please come in, that's a short and polite way to welcome someone into your home. You could also say, sure, come on in.
You might also hear the parent say, we're okay, just a bit tired. The phrase a bit tired is a gentle way to say you're very tired, but trying your best. Another way to say it is, we're managing, just tired from the nights.
The nurse will often ask, can I wash my hands before we start? That shows they're careful about hygiene before touching the baby. Some might say, I'll just wash my hands first, if that's okay.
When you explain, mostly breastfeeding, but we sometimes give a bottle, that's telling you they're your routine. You could also say, we do both, breast and formula.
Describing baby sleep as he sleeps in short blocks, 2 or 3 hours, is very common. The word blocks means short time periods. Another way to say it is, he wakes up every few hours.
If the nurse says something that's hard to follow, don't worry. You can ask, could you say that again more slowly? Or, I'm not sure I understood. Can you explain it in simpler English?
That's a good way to stay calm and still get the help you need.
Next, we'll go deeper into how to talk about feeding and sleep, 2 things every new parent deals with.
Let's move into one of the biggest parts of the nurse visit, feeding and sleep.
These are usually the first things the nurse will ask about, and you don't have to explain everything perfectly. Just simple, honest answers are enough.
Let's try a role play. I'll be the nurse again, and you're the parent. How is feeding going so far?
It's going okay. I'm breastfeeding, but sometimes we give formula too.
Got it. And how often does your baby feed during the day?
Every 2 to 3 hours, usually.
And at night?
He wakes up twice, sometimes 3 times.
How about sleep overall? Are you getting any rest?
Not really. I try to nap when the baby sleeps.
That's a good idea. And just checking, any spit up, choking, or trouble swallowing?
No, nothing like that. Just a little spit up sometimes.
Okay, that all sounds very normal.
That's how a real conversation with the nurse might go.
Let's take a closer look at some of the phrases you can use.
When the nurse asks, "How is feeding going so far?" they're just inviting you to share your experience. You could reply with, "It's going well, but we're still adjusting."
When you say, I'm breastfeeding, but we sometimes give formula, that tells the nurse your baby is mixed fed. You could also say, we use both, breast and bottle.
Then they might ask, "How often does your baby feed?" This means how many times during the day. You can answer with every 3 hours or so.
When you say, he wakes up twice at night, that's totally normal for newborns. You could also say, he usually wakes up around midnight and 3 a.m.
When they ask, "Are you getting any rest?" they're really checking on your well-being. You might say, "I try to nap when I can."
And if they ask about spit up or choking, they're checking if feeding is safe. You can say, no choking, just a little spit up sometimes.
If your baby's sleep and feeding pattern don't follow a perfect pattern, that's okay.
Every baby is different, and the nurse is there to support, not judge.
You're doing a great job already by showing up and talking about it.
Next, we'll help you describe your baby's growth, like height, weight, and movement in clear, simple English.
Sometimes during the visit, the nurse might gently pick up your baby or ask to weigh them. You might feel nervous, especially if you're not sure what's normal.
That's totally okay. The nurse is checking things like weight, height, and how your baby moves. Let's try a short role play so you know what that conversation might sound like.
Is he growing okay?
Yes, his weight and height are on track for his age. He's gained 500 grams since the last visit.
That's great. What's his weight now?
He's 5.8 kilograms.
That's very healthy for his age. Has he started rolling over?
Not yet, but he does lift his head during tummy time.
That's perfect. Lifting the head is just what we want to see at this stage.
Thanks. I always wonder if he's developing fast enough.
You're doing great. Every baby grows at their own pace.
Let's take a closer look at that conversation.
There were some useful expressions in there.
Is he growing okay? This is a simple way to ask about your baby's overall development. You could also say, is his growth normal?
He's gained 500 grams since the last visit. That means your baby is putting on weight in a healthy way. You could also say, he's been gaining weight steadily.
What's his weight now? This helps you understand where your baby is at. You could also ask, how much does he weigh?
Has he started rolling over? This is a way to ask about movement milestones. You could also say, has he started turning on his side?
He lifts his head during tummy time. That shows early muscle strength. You could also say, he pushes up a little when he's on his stomach.
You might also want to ask, what if my baby isn't doing those things yet?
The nurse may say, that's okay. Every baby develops at their own speed.
In the next part, we'll show you how to ask questions or share concerns, especially if something doesn't feel right.
Sometimes during the visit, you have a question, but you're not sure how to ask it. Maybe you're worried about something small, but it feels big to you. That's completely normal. Nurses expect parents to have questions or doubts. Let's do a quick role play to show how those conversations might go.
Can I ask something? He sometimes has a rash on his neck.
Of course, that's common in babies, usually from heat or drool.
Should I put cream on it?
Yes, a mild baby cream should help. If it gets worse, let your doctor know.
He also spits up after every feed. Is that normal?
Yes, that's very normal. As long as he's gaining weight and seems happy, it's not a concern.
Okay, I just worry I'm missing something.
You're doing great. It's always good to ask.
Let's take a closer look at that conversation.
There were some helpful ways to ask questions in there. Can I ask something? This is a gentle way to bring up a concern. You could also say, I have a quick question about something.
He sometimes has a rash on his neck. That's a clear way to explain what you see. You could also say, I noticed a red area here. Should I be worried?
Should I put cream on it? You're asking for advice, which nurses are happy to give. You could also ask, is there something I should use?
He spits up after every feed. Is that normal?
This question shows curiosity, not panic. Another way to say it, he spits up a lot. Do I need to be concerned?
I just worry I'm missing something. This is a very natural thing for new parents to say. You could also say, I feel like I'm not sure what's okay and what's not.
You might also want to ask, what signs should I look out for? The nurse may respond with, if anything seems unusual, just call or check in.
And sometimes just hearing, you're doing great, is exactly what you need.
In the next part, we'll talk about how to understand the nurse's feedback or advice and how to respond in simple English.
Sometimes during the visit, the nurse might give you advice about feeding, growth, sleep, or daily care. It can feel like a lot, especially if English isn't your first language.
Don't worry. Nurses often speak gently. They're not giving you rules. They're offering support.
Let's try a role play to see what that kind of advice might sound like.
He seems a bit gassy today. Have you tried burping him more often?
Not really. Should I burp him after every feed?
Yes, that usually helps. Try holding him upright for a few minutes.
Okay, I'll try that today.
I also noticed some redness under his chin. Keeping the area dry may help.
Got it. Should I put anything on it?
Just a little cream if it looks sore, but mostly just clean and dry.
Thanks. That helps a lot.
That's a typical way advice might sound in real life.
Let's take a closer look at some of those phrases and how you can respond to them.
When the nurse says, he seems a bit gassy today, they're gently pointing out something they noticed. You might also hear, he looks a little uncomfortable.
Then they may ask, have you tried burping him more often? This is a soft suggestion, not a pressure. They could also say, it might help to burp him a bit more often.
If you say, should I burp him after every feed? You're asking for clear advice. You could also ask, how often should I burp him?
The nurse might say, try holding him upright for a few minutes. This is a common suggestion after feeding. Another version is, sitting him up could help with digestion.
You might hear, I noticed some redness under his chin. That's how nurses gently point out something you may not see. You could also say, his skin looks a bit irritated here.
If you ask, should I put anything on it? You're trying to be careful before acting. You could also ask, do I need to use cream or just clean it?
Sometimes nurses say things like, it might help, or you could try this. That's just their way of giving options, not saying you're doing anything wrong.
You can always ask again, try something small, and see how your baby responds.
Next, we'll do a short review and repeat challenge to help you remember some of the key phrases from today's episode.
Today, we walked through the full experience of a child health nurse visit, from saying hello to talking about feeding, sleep, growth, and asking questions. You've learned how to understand advice and express your concerns with simple, clear English.
Now let's review some of those useful phrases and give you a chance to say them out loud.
We'll say them one more time, and you can repeat after Henry. Ready?
Let's go.
How is feeding going so far?
How is feeding going so far? How is feeding going so far?
He sleeps in short blocks, 2 or 3 hours.
He sleeps in short blocks, 2 or 3 hours. He sleeps in short blocks, 2 or 3 hours.
Is he growing okay?
Is he growing okay? Is he growing okay?
Should I put cream on it?
Should I put cream on it? Should I put cream on it?
I just worry I'm missing something.
I just worry I'm missing something. I just worry I'm missing something.
Every parent has questions. Asking is a strength, not a weakness.
You don't need perfect English. Just a few real phrases can go a long way.
If you found today's episode helpful, try saying 1 or 2 of these sentences out loud right now.
Or leave us a comment. What was one sentence you'll try using next time?
Don't forget to follow, like, or subscribe.
It helps more people find this show and it supports what we do.
See you next time.